Okay, so get ready because today we're diving into a story that is both inspiring and kind of unsettling.
Definitely a story with a lot of layers.
Exactly.
Hmm.
And it all starts with a pretty stark fact. You ready for this?
Hit me with it.
All right. In the early 1900s in America, get this, more women died in childbirth than men did in war.
Wow. That's that's a heavy statistic. Really puts things in perspective.
It does, doesn't it? It just highlights how desperate the need for accessible health care was back then, especially for women in rural areas.
Absolutely. And that's where our main character, I guess you could say, Mary Breckinridge comes in.
Exactly. Mary Breckinridge, she saw that problem and basically dedicated her entire life to fixing it.
She was quite the pioneer, founded the Frontier Nursing Service, brought essential medical care to the Appalachian Mountains.
Yeah, an area that was really struggling with poverty and lack of access to doctors or really any kind of proper medical care.
Right. But here's the thing, and we want to be upfront about this from the start. Breckinridge's story, it's complicated.
Yeah, there's definitely another side to her, a side that's not so easy to celebrate.
Exactly. While her accomplishments with the Frontier Nursing Service are undeniable,
Mhm.
she also held some beliefs that today we recognize as deeply flawed, especially her support for the eugenics movement.
Yeah, we're not going to shy away from that. It's
Mm.
part of her story,
Mhm.
and it's something we need to confront if we're going to truly understand her legacy.
I think it makes it even more interesting, to be honest. It's not just a simple hero narrative. It's a story that challenges us to think about the complexities of history and the people who shaped it.
I totally agree. So where do we even begin with someone like Mary Breckinridge?
Yeah.
What made her who she was?
Well, she came from a pretty prominent family. Her father was a congressman, so she had a lot of privilege, and she got a great education, traveled all over the place. But her life was also marked by a lot of loss. She lost two young children.
Oh, wow. I hadn't realized that.
Yeah, her daughter died just hours after being born, and then her son died at the age of 4. Unimaginable, really.
It's heartbreaking, and you can really see how those tragedies might have, fueled her passion for children's health, how it could become her life's work.
I think so too. And, these personal tragedies happened alongside some major world events that also really impacted her, like the 1918 influenza epidemic. She was a Red Cross nurse during that time. She saw firsthand just how devastating a lack of health care could be.
And then she worked with the American Committee for Devastated France after World War One.
Mm.
Seems like her time in Europe really had a profound impact on her and her vision for the frontier nursing service.
You're absolutely right. It was in France that she saw how effective midwives could be, especially in those rural areas where doctors were scarce.
So that planted the seed for her to bring that model back to the U.S.
Yeah.
But why the Appalachian Mountains? Why choose such a rugged and isolated region for this kind of ambitious project?
Well, for one thing, the region was desperately underserved medically. I mean, poverty was widespread. People couldn't afford to travel for care, even if it was available.
And I imagine the vast distances and the limited infrastructure made things even tougher.
Yeah, it was a logistical nightmare. But Breckinridge, she saw those challenges as an opportunity, almost like a test case. If she could make it work in Appalachia, she could make it work anywhere.
It was a bold move for sure. And, her family's southern roots probably helped her connect with the people and raise the funds she needed to get the FNS off the ground.
You're right about that. She was a master fundraiser, always leveraging her connections to support the cause. And it's interesting, there's this story from her time in France. It's called the Goat Crusade.
Oh, I've heard about that. Tell me more.
So Breckinridge, she's in France, and she sees all these families struggling with malnutrition after the war, and her solution, goats.
Goats? Seriously?
Yep, she launched this whole fundraising campaign to buy goats for families in need. She realized that goats were hardy, they could survive in tough conditions, and they could provide milk and cheese, which were, essential sources of nutrition.
It's such a simple but brilliant idea, shows you how practical she was.
Totally. And it kind of foreshadows her approach to the frontier nursing service. She wasn't interested in just, theories and ideas. She wanted to find solutions that actually worked for the people she was serving.
So she sets her sights on Appalachia, this incredibly challenging region, determined to bring modern healthcare to its people. But where do you even begin with something like that?
Yeah.
What were her first steps in establishing the FNS?
Well, it wasn't easy, that's for sure. Try to imagine trying to build a healthcare system from scratch in a place with limited roads, almost no telephones, and widespread poverty.
You gotta be kidding. That sounds impossible.
It was incredibly difficult, but Breckinridge and her team, they were incredibly resourceful. They had to be. And there's this amazing film from 1931. It's called The Forgotten Frontier, and it really
Right.
captures the challenges they faced in those early days.
I've heard of it. Have you seen it?
I have. It's Pretty incredible. It shows their headquarters, this simple log cabin called Wendover, and it's nestled deep in the mountains. You see these nurses on horseback traveling miles and miles to reach their patients, sometimes even braving icy rivers in the winter just to deliver
That's
babies.
like something out of a movie.
It's a powerful testament to their dedication, and the film itself actually played a really important role in the success of the FNS.
How so?
Well, remember, the organization relied heavily on private donations, and the film was a brilliant fundraising tool. It showed people the dire needs of the community. It put faces to the statistics. It allowed people to connect with the mission on an emotional level.
I bet it was incredibly effective. People probably lined up to donate after seeing something like that.
They did. It really brought the struggle to life, made it real for people.
Speaking of statistics, the film claims that the FNS reduced maternal mortality rates in the Appalachian Mountains by 2/3. Is that accurate?
Well, that specific figure is probably a bit of an exaggeration, common tactic in promotional materials. You know how it is. But even with more conservative estimates, it's clear that the FNS had a significant positive impact on maternal and infant health.
So the numbers might have been slightly inflated, but the overall impact was undeniably good.
Exactly. And the founding of the American Association of Nurse Midwives in 1929, just 4 years after the FNS was established, that really shows you how influential Breckinridge was in this field.
She wasn't just treating patients. She was building a whole new model for healthcare in underserved areas.
Exactly. And her autobiography, White Neighborhoods, that also helped sustain the FNS.
I was just going to ask about that. How did the book help?
It served a couple of purposes. It was a personal account of her journey, but it was also this clever fundraising tool.
Yeah.
Proceeds went directly back into the FNS, helping to ensure that they could treat anyone who needed help, regardless of their ability to pay.
It sounds like she was a real visionary, always thinking about the long-term sustainability of the FNS, making sure it could continue to serve the community.
Yeah, and here's where we have to address the more difficult part of her story. As we mentioned before, there's a darker side to Mary Breckinridge, one that's not so easy to reconcile with all the good she did.
Right. Her beliefs in eugenics, that's something we can't ignore. It's a crucial part of understanding who she was and the impact she had.
It's a challenging conversation, but it's one we need to have. It's tough to talk about, but yeah, Mary Breckinridge, she was a firm believer in eugenics.
Eugenics, for those who maybe aren't familiar, can you explain what that is?
Sure, it was a movement pretty popular in the early 20th century, and it was all about, trying to improve the human race through selective breeding, basically controlling who could have children and who couldn't.
It sounds awful like something out of a dystopian novel.
Yeah, it definitely has that vibe looking back on it. And it's important to say that eugenics led to some truly horrific practices, forced sterilizations, discrimination against entire groups of people. It was a dark chapter in human history.
So how could someone like Breckinridge, someone who dedicated her life to helping others, also believe in something so harmful?
It's a question a lot of people have asked, and I don't think there's an easy answer, but it's crucial to remember that eugenics was shockingly mainstream back then. It wasn't just some fringe group. You had scientists, doctors, politicians, even some prominent feminists who supported it.
So she was a product of her time, in a way.
To a certain extent, yes, but I don't think we can just let her off the hook. It's important to understand the historical context, but that doesn't excuse her beliefs.
Right. It's not about excusing her. It's about trying to understand how someone could hold such contradictory views. And it's about acknowledging the harm that those views caused.
Absolutely. And in Breckinridge's case, her belief in eugenics wasn't just some abstract idea. It directly influenced her work with the Frontier Nursing Service.
In what way?
Well, she believed in the superiority of white Anglo-Saxon bloodlines, and that belief shaped a lot of her decisions. For instance, she had to personally approve any tubal ligations performed by the FNS nurses.
That's disturbing. It makes you wonder if her decisions were always based on what was best for the patient or if her own biases were influencing her judgment.
It's impossible to know for sure, but it's a valid concern, especially given her outspoken views on eugenics.
And it wasn't just tubal ligations. She also had strong opinions about birth control, right?
She wasn't a fan of birth control. She believed in empowering certain families to have more children while limiting the reproductive choices of others.
It sounds like she was trying to control the population, to shape it according to her own beliefs
Yeah.
about who is fit to reproduce, who's worthy of having children.
That's one way to interpret it, and it reflects a common thread in eugenicists' thought, this fear that certain groups were reproducing at higher rates and would somehow dilute the quote-unquote superior bloodlines.
It's a chilling thought, and
Yeah.
unfortunately it's not just a relic of the past. We still see these kinds of ideas popping up today, this fear of of the other, the desire to control who gets to have children and who doesn't.
Yeah, you're right. It's a reminder that we have to be constantly vigilant. We have to challenge these kinds of harmful ideologies whenever and wherever they appear.
So back to Breckinridge. We have this woman who did incredible things. She brought healthcare to a region that desperately needed it, but she also held these deeply problematic views. How do we reconcile those two sides of her?
That's the million-dollar question, isn't it? I don't know that there is a simple answer. I think it's about holding both of those truths in our minds at the same time, recognizing that someone can be both a hero and a villain, both a force for good and a perpetrator of
This
harm.
is about nuance, right? It's about understanding that history is rarely black and white. It's messy, it's complicated, and it's full of contradictions.
Exactly. And I think it's also about recognizing the harm that was done, not just by Breckinridge, but by the entire eugenics movement. We can't forget the victims, the people who were sterilized against their will, the families who were torn apart, the communities that were targeted and marginalized.
A heavy legacy to grapple with.
It is, but it's a necessary conversation to have if we want to learn from the past and create a more just and equitable future.
So much to think about. We've covered so much ground. The incredible work of the Frontier Nursing Service, the countless lives saved, but also this dark side of Mary Breckinridge, her belief in eugenics.
It's a lot to process, isn't it?
It really is. I keep finding myself going back to that 1931 film, The Forgotten Frontier.
Mm-hmm.
It's beautifully shot. The nurses are so clearly dedicated to their work, and the impact they had on the community is undeniable. But now knowing what we know about Breckinridge's beliefs, it's hard to watch it the same way.
I get it. It's like there's this shadow hanging over everything.
Exactly. And it raises a really tough question. How do we separate the art from the artist, so to speak? Can we appreciate the good work of the FNS without condoning the beliefs of its founder?
That's a question that comes up a lot, not just with Breckinridge, but with lots of historical figures.
Right. It seems like every week there's a new controversy about some historical figure, someone we thought was a hero, turns out to have done some pretty terrible things.
It's enough to make you want to give up on heroes altogether.
I know, but I don't think that's the answer.
Yeah.
I think it's more about accepting the complexity, recognizing that people can be both good and bad, capable of both great acts of kindness and terrible cruelty.
It's about nuance, right? Seeing the whole picture.
Exactly. And I think in the case of Mary Breckinridge, it's about acknowledging both the good and the bad, celebrating the legacy of the FNS and all the lives it saved, but also being honest about the harm that was done because of her beliefs, the potential for bias in her decisions, the ways in which her worldview might have limited the choices of the very people she sought to help.
And it's about recognizing that this isn't just about Mary Breckinridge. It's about how we engage with history as a whole. We can't just pick and choose the parts we like. We have to confront the uncomfortable truths, too.
Because ultimately, it's all connected, right? The past shapes the present. If we want to create a better future, we have to understand where we came from, the good, the bad, and everything in between.
That's a great way to put it. It's about learning from history, not just repeating it.
Well said. Well, I think that about wraps up our deep dive into the life and legacy of Mary Breckinridge. It's been a fascinating journey, and one that's left me with a lot to think about.
Me too. It's a story that stays with you.
And as always, we encourage our listeners to continue exploring, to keep asking questions, to keep learning.
Because the conversation never really ends, does it?
It doesn't, and that's what makes history so fascinating. So thanks for joining us on this deep dive. We'll see you next time.